that particular panel, the panel that dealt with engaging healthcare consumers, that's a very broad topic, but the participants, the folks who put that panel on, included industry, so J&J was an anchor there, included the payer community, so we had United Healthcare, included retail, we had Kroger, but more importantly perhaps it was a representative from Kroger's orientation toward healthcare consumers. So it was the person who oversees the clinic business and interacts with pharmacy at the retail setting. That's really the model for the future. And what we talked about yesterday and what they shared with all of us is now going to be, sort of taken into action and execution over the next year. And they've already promised that they'll be back to share their successes with us next year. The ultimate success for the industry is to achieve these kinds of innovative collaborations at scale, to be able to really wrap our arms around the consumer and say, whether you're interacting with your insurance company and trying to understand how to appropriately access OTCs, or you're at retail and you're asking a question of a retail healthcare professional, or you're acting on your own and interacting with a brand message, can we sort of align those messages so that it's really straightforward for the consumer and simple? I think that's the other big thing that came from this is we may have grandiose ideas, now we have to simplify it.
I think if you're in the consumer healthcare business, it's a lot more than selling consumer brands in the store, off the shelf. The aisle is very complex. Even we heard the cough-cold aisle or the analgesic aisle are usually 8 to 10 feet wide. So there's so much choice, and the consumer needs information. They need help. They need to say, what's relevant to me? How can you help me with my chronic condition like diabetes or asthma or any other chronic condition they have? It's a matter of information, knowledge, links, help. Not always a matter of going to the doctor and asking the doctor. So it's complex, and it's going to take a coalition of support, as Mary Alice has just described, to help consumers through that.
Yeah, it's too much information. No one can process that. And so we've a little bit put too much burden with, if you will, sort of older convention on the backs of consumers. We have the opportunity now to really support them in new and different ways using, I know the term is, sort of used broadly, but technology, but perhaps more importantly, the information that we each have and have the right to access, and that exists for us to access. And now, this industry perhaps can figure out how to make those linkages and help people in that aisle so that they can make the right choice and they do feel empowered and they do feel confident, or what Dr. John Delft spoke about yesterday, which is self-efficacy, really being able to truly confidently and competently act on our own. That's the holy grail.
Yeah.
Yes, the President said in February, who knew healthcare was this complex? But for the individual, they're probably saying to themselves, who knew my healthcare was this complex?
Right.